GatewayC Bitesize, supporting earlier and faster cancer diagnosis, commissioned by the Greater Manchester Cancer Alliance. Brain tumour. Think A to G. Our specialist is Dr. Catherine McBain, consultant clinical oncologist. A. Any progressive symptoms?
Brain tumours can present with lots of different types of symptoms, depending on the type of tumour and where it is in the brain. What's important is to look for any new neurological symptoms and ask carefully about whether these are progressing. Any symptom progressing over 2 or 3 months should be investigated further. Common symptoms include changes in mobility, balance, speech, cognition, mood or vision. Also think, could any of these symptoms be seizures?
B. Behaviour changes.
First symptoms can include changes in personality or mood, such as irritability, disinhibition, odd behaviours, low mood or slowing of cognition. Differentials can include depression or dementia, but brain tumour symptoms progress over a short number of months.
C. CT or MRI scan.
Although a CT scan will show gross changes such as swelling in the brain, and it may be useful in someone with marked symptoms of raised intracranial pressure, a normal CT scan does not exclude a brain tumour. An MR brain scan with contrast is what's required.
D. Don't forget headache plus.
It's uncommon for headache alone to signify an underlying brain tumour. The headaches of concern are those which are clearly increasing in frequency and severity over a number of weeks or months, or which are associated with other progressive neurological symptoms. It's important to take a very detailed history in anyone with headaches, looking specifically for even subtle changes in speech, such as word-finding difficulties, changes in cognition or mobility.
E. Eye tests.
Detecting papilledema in the clinic is difficult and it's not always present. High street optician assessments can rapidly detect or confirm visual field loss or disc swelling and are a useful source of additional assessment. Confirmed visual field loss is a finding highly suspicious for an underlying tumour, although normal results do not necessarily exclude a tumour.
F. Fits.
Fits or seizures are a very common presenting symptom of brain tumours. Anyone presenting with new onset seizures should be referred for urgent assessment. It's important to remember that not all fits are generalised seizures associated with loss of consciousness. Fits can include olfactory hallucinations, classically people smelling a burning smell, absences, transient loss of speech, déjà vu or sensory symptoms. Symptoms may be preceded by an aura and followed by a period of drowsiness. Any increase in frequency, duration or severity of episodes should raise concern.
G. Greater Manchester Referral Proforma.
Please refer all patients using the Greater Manchester Referral Proforma. Please ensure the patient understands the reason for the referral and ensure that the referral contains a specific clinical history, highlighting the things mentioned. Thank you.
Think A to G. A. Any progressive symptoms. B. Behaviour changes. C. CT or MRI scan. D. Don't forget headache plus. E. Eye tests. F. Fits. G. Greater Manchester Referral Proforma. GatewayC Bitesize, supporting earlier and faster cancer diagnosis, commissioned by the Greater Manchester Cancer Alliance.